The following segment is sponsored by Renown.
It's estimated there are some 15.5 million cancer survivors in the U.S., but it takes a lot of work to get there, and there's a lot to be done after treatment. We've got DrLykins here, a nurse navigator with Renown Institute for Cancer, to talk a little bit about how these cancer survivors are getting past treatment and then what happens after that.
Once the treatment is done, it's important that you continue to see your doctor very frequently for the recommended follow-ups. Now, depending on which kind of cancer you were diagnosed with and at which stage it was diagnosed, those follow-ups may vary. It could be very frequent. Generally, it's very frequent at the beginning after the treatment's done. Assuming everything goes well, those appointments tend to stretch out a little bit farther, and that's normal and that's okay. Some of the late effects and long-term effects that people can have after their treatment is done, it really depends on what kind of treatment they got. So they can range anywhere from physical effects such as sometimes some pain or shortness of breath. Sometimes people have issues with anxiety and depression. Sometimes people have even sexual health problems. Weight, either gaining or losing weight, can sometimes be an issue.
And survivor care is really a big part of this. What does that include?
So survivor care is supporting the survivor through that transition of completing treatment and going on through the follow-up scans. Usually that goes on for about 5 years. And so it's an extended period of time. So friends and family members a lot of times think once the active treatment is done that the whole journey, cancer journey, has finished, but that's not true. Actually, it's important to support those survivors throughout the follow-up period. It's really important that survivors do follow their recommended guidance from their doctors and for their surveillance and scans and follow-up. And healthy living is always good. It doesn't guarantee anything. It does. It works more like a seat belt. So a healthy diet, including lots of fruits and vegetables, stopping smoking if you're a smoker, limiting alcohol intake, and getting some exercise. These are important things that everybody should be doing, but especially cancer survivors.
All right, a lot of great information, and if you'd like to check out more on this, you can always go to bestmedicinenews.org. Thank you so much for being with us.
Thank you for having me.